Racism as a public health crisis. Many towns made this declaration last year. The declaration acknowledges the stark disparities systemic racism creates for people of color in housing, education, employment, and in their physical health.
It's within a lot of different things that we interact with on a day-to-day basis.
In New Haven, the Board of Alders declared racism as a public health crisis last July. In the month since, a working group has come up with dozens of recommendations to tackle the issue. The Board of Alders passed that list in February.
I really hope that it starts to actually change the community context or the neighborhood context.
Dr. Brita Roy, Director of Population Health for Yale Medicine, is a part of the working group.
Currently, the neighborhood conditions are creating and sustaining places where people are not as healthy.
The recommendations include supporting free public transportation for all, giving every student 3 healthy meals a day, increasing affordable housing, and creating a system that will help community health groups screen patients for symptoms of post-traumatic stress disorder. In Middletown, an anti-racism task force was formed shortly after the town made its own declaration in June 2020. Councilmember Ed Ford Jr. sits on several boards, including the task force.
This is something that needs our immediate attention.
The task force is in the process of coming up with recommendations for the Board of Alders. Task force members say one of the biggest issues that needs to be addressed is job access.
Residents of color do not necessarily feel that they have access to jobs that support their skills and qualification.
Member Dr. Kayan Morgan says she's hoping a year from now, the force will help Middletown enact changes that last beyond this generation.
We are building the foundation, but whatever we build, we want to make sure that that's sustainable.
Now that the Racism as a Public Health Crisis declaration is signed into law, a statewide commission will be formed to study the impact of racial disparities on public health and make recommendations to reduce that impact. A gun violence advisory committee will also be formed to strategize how to prevent shootings. Hospitals will also have to require implicit bias trainings for employees that work with pregnant and postpartum women. Sharon Johnson, Channel 3 Eyewitness News.
Now, Channel 3 Early Warning Weather.
The most active part of the